Information processing is a different topic. So far we talked about this area, okay, this neuron. So stimulus comes here, stimulating the dendrites. Information is processed in the cell body, is transmitted through the axon, and here is the neurotransmitters are released. And now we are talking about this one. So what's happening in the postsynaptic membrane? So this is what will happen in this area. So this is the thing that we will discuss in the next few slides. So the postsynaptic membrane, okay, so again we are going back to the type of neurotransmitters and the channels. So you have here a plasma membrane, and you have the different channels here. You have the receptor and neurotransmitters comes here. That will open up the channel, and that becomes more positive, okay. So it can, so this ion can be a sodium or it can be a calcium. So the inside the cell become more positive, which means what? Depolarization, okay? Increasing the cell membrane potential, getting it closer to the threshold, getting it closer to zero, or making it more positive. So these are called excitatory. Okay, excitatory postsynaptic potential. The other one is different, so that makes the cell inside the cell more negative. So here a neurotransmitter comes, potassium leave, or chloride enters the cell. Inside the cell become more negative. So this is hyperpolarization, and these are called inhibitory postsynaptic membrane potential. Inhibitory, further away from the threshold. So if you get a lot of inhibitory postsynaptic potential, what will happen? That will go further away from the threshold. That will inhibit action potential. And opposite of that is summation. That you will get a lot of positive, a lot of positive graded potential, or a lot of positive depolarization, I should say. And the combination of all of them together will increase the membrane potential, and that will cause an action potential. Not always, but it increases the chance of having an action potential. So you may get, one neuron may get multiple stimuli. Some of them may be inhibitory, some of them may be excitatory. So if the number of excitatory are higher than inhibitory, they accumulate. That's why it's called summation, and that will increase the resting membrane potential, causing depolarization and increased chance of having an action potential. So based on how they will accumulate, you can have the temporal summation or a spatial summation, which I will explain it in this image. So in the temporal summation, so they are coming back to back. So that related to time. So one after another, they have to be very close to each other. When they are very close to each other, the potential will accumulate and increase, getting above the threshold. Once above the threshold, it will cause an action potential. So this usually happens in the body. You do not get one strong stimulus. You get many small stimuli. And an accumulation of all of them together, that will cause an action potential. So that over time, but they have to be very close to each other. The other one is that multiple stimuli from different neurons arrive at the same time. When they arrive at the same time in the same location, very close to each other, that stimulate the plasma membrane that goes above the threshold, and that will cause the action potential. So if they are small, then many of them should be there. Okay, if this was only one of them, it may cause a depolarization, but it will not cause an action potential because it stays below the threshold. So if many of them comes, they will go up, they accumulate, and they will go above the threshold, which cause action potential. And facilitation is just a part of the summation. So here you get one stimulus, it can cause a depolarization, another stimulus, so that accumulates, another stimulus. So this is part of the temporal summation. So once it gets to here, means this is called facilitated. Facilitated. So it means what? It means that increased chance of having an action potential if you have another stimulus. If the threshold is here, and this is so close to the threshold, you get a small stimulus that will go above the threshold, it will cause an action potential. If you get a small threshold here, it will not cause an action potential. So this is not facilitated. It has to be very close to the action potential. I mean, very close to the threshold. And that is increasing chance of action potential. So here you have one axon and it's connected with another cell, and that cell can be, depends on the location. Can be a neuron, it can be a muscle or anything. But in this case, you have a third neuron, and that neuron will affecting this neuron. So depends on what is released from the third neuron, then the final outcome is a little bit different. So in here you have one axon, and once the action potential comes, the calcium enters and the vesicles will release the neurotransmitter, and that will affect these channels in the postsynaptic membrane. Okay. Here you have a different neuron that will release GABA. GABA is inhibitory. Once GABA is released, the amount of calcium that enters the cell will decrease. If the amount of calcium decreases, there is less exocytosis of the neurotransmitter vesicles, and less neurotransmitters are released in the synaptic cleft, and less of them are attached to these channels. So this cell will not be stimulated as much. If you compare that with this one, you have a different type of neurotransmitter, which is serotonin, and that can be an excitatory neurotransmitter. And here more calcium enter. When more calcium enter, more vesicles attached to the presynaptic membrane, more neurotransmitters are released, and those neurotransmitters are attached to these channels and stimulate the postsynaptic membrane a lot more. So it depends on the type of the neurotransmitter that is released from a third neuron, then the final outcome will be very, very different.